This video is about post-operative care in the ward after major surgery. The objectives of post-operative care include enablement for a successful and faster recovery of the patient post-operatively, reduce post-operative mortality and morbidity, reduce patient cost during the ward admission, reduce length of the hospital stay, and to provide quality of care and patient satisfaction. Post-operative care starts as soon as the operation is completed and the patient regains consciousness after general anesthesia. Subsequently, this can be divided into 3 phases. The first phase is immediately following surgery in the recovery room, and the second phase is when the patient is transferred to the ward. The third phase is defined period when the patient is recovering at home after discharge. Post-operative care in the ward can be grouped under some categories. The first important category includes monitoring the vitals. It is important to document what is to be monitored and how often the monitoring has to be done. For example, 4, 6, 8, 12 hourly or continuously. It is also important to document and to have an understanding that if there is a problem, how will it be recognized and who will be informed. For example, if the blood pressure suddenly drops, the patient becomes cold and clammy, then the surgeon should be contacted urgently. Patients requiring continuous monitoring have to be placed in a special care unit. Patients who need assistance in breathing will require ICU. And if a patient has an existing cardiac problem or if they had a cardiac event during surgery, they will require care in a cardiac unit. Now we come to the most important category of drugs. Fluids are given intravenously post-operatively, but the rate and the total amount of fluids that have to be given has to be confirmed. Overinfusion can be a cause for morbidity, so be careful, especially when patients are elderly, have a weak heart, or are hypertensive. Pain relief will depend upon the site of the operation and should not carry any risk for the patient. For example, you cannot give Panadol to a patient who has liver damage or give non-steroidal analgesics to patients with a history of asthma. Before prescribing antibiotics, check there is no history of allergy. Ensure the correct dose and route by which it is being provided. Antibiotics should be according to international guidelines and local patterns of drug sensitivity and resistance of bacteria. Other drugs given routinely may include antiemetics and antacids. If your patient has been on medications prior to the surgery, these should be continued after surgery. These include antihypertensives, drugs for cardiac arrhythmias, thyroxine, drugs for diabetes, and asthma. At times, special medications are administered during the hospital stay. These include prophylaxis for DVT, sliding scale for administering insulin, and intravenous painkillers. Ambulation is a very important part of post-operative recovery. Ambulation is usually encouraged to prevent deep vein thrombosis. Most patients will be kept on bed for the first 6 to 24 hours after surgery. After some procedures, patients' movement is restricted. For example, in ureterovaginal fistula repair, patient is restricted to prevent breakdown of the repair. The surgeon will prescribe the amount and the duration of bed rest. DVT prevention protocol is used until the patient is fully ambulant, and the stockings are discontinued once the patient is ambulatory. The DVT protocol may include drugs. Resumption of diet will depend on the type of surgery. The patient is kept nil per mouth for a minimum of 6 to 8 hours following an uncomplicated abdominal surgery. After 6 to 8 hours, the patient is provided with clear fluid diet. routine diet is allowed after 24 hours. Strict control of infection control should be maintained and in the ward, and this includes washing hands before and after touching the patient and after care of the wound. Ensure the environment is also kept clean. Performing procedures such as removal of drains and catheters after hand washing and wearing sterile gloves. Removal of intravenous cannulas, removals of packs should be carried out as instructed by the operating surgeon, and the notes should be daily reviewed to ensure that removal takes place at the correct time. Maintain communication, both verbal and written, with nursing staff and your team. Good communication with staff in the ward is an essential component of care. Also, make sure you communicate with the patient and the relatives about recovery. This ensures patient satisfaction, keeps the patient and the family involved so they can continue patient care once he or she is discharged. Post-operatively, patient may need for certain laboratory or radiological investigations. These should be documented, sent timely, and followed up diligently. With this, we come to the end of this video. If you like this video, press the like button, subscribe, and share. And please comment. Press the bell icon for notification of future videos. Goodbye and thank you.